All right, so I'm gonna show you guys how to start an IV. Make sure that you have a doctor's order as always. Also remember there are more than one way, multiple ways to start an IV, so this is just the way that I start mine. Make sure that you follow your policy and procedure through your facility as well as your checklist for your nursing school if that's where you're at. The first thing you want to do after you do hand hygiene is select the appropriate arm. Make sure you take a peek at the order. Make sure you check on the patient. There are certain reasons that they may not be able to have an IV in one area or not, such as maybe a blood clot or a fistula of some sort. So make sure that this arm is okay to have an IV. So for this, we're going to look at our patient. I always recommend feeling for the IV with gloves on. You'll see some nurses will pull the glove off of their finger when they're feeling for an IV. That puts you at risk for blood contamination. It also puts you at risk for poking yourself, more at risk. You don't have that barrier from the glove. Plus, you actually desensitize your finger, so it's harder to feel for veins through gloves. I recommend take a pair of gloves home, close your eyes, and just feel on anyone you can feel. That way you can start to get that finger sensation. So I'm gonna feel my patient. We're gonna go ahead and put our tourniquet on. When you put the tourniquet on, remember it can only stay on for a short period. So I'm gonna go ahead, put it on nice and tight. When you do that, you pull it really tight here. And then you start to make a bunny ear like you're gonna tie it, and then you stop. So you see I got the little bunny ear. That's gonna make these veins pop up. Some people with fragile skin, you can also use like a blood pressure cuff pumped up. So I see we've got a couple here. I'm gonna go ahead and release my tourniquet while I set up my supplies. I know right around this area is where I'm gonna do my IV. So when I set up my supplies, you need this called a J-loop here, but you know, it could be different per facility. So when I open that up, it comes with a clamp here. You wanna make sure that clamp is nice and open, that purple clamp. And this right here is a little plastic piece that will come off. So I'm gonna go ahead and loosen that up. I'm gonna put it back in the tray just to make sure it stays nice and clean. Then you're gonna take a sterile syringe of saline. When you prime this, you wanna get that air bubble out. So I pull back a little to break the seal, and then just push it up to where you see that little bubble at the top. I'm going to connect it like so. All right, you need your dressings. Remember, don't do this actually on the bed. We're doing that just for demonstration purposes. So this is our IV dressing. Use whatever you guys have. I like to take off my backing. It just makes it easier for me, but again, you know, follow whatever your policy is. And you want to choose which IV you have. There are multiple different kinds. 20 or a 22 gauge are kind of the most commonly used. 20 gauge is for your typical patient, maybe somebody getting blood drawn. A 22 gauge might be for somebody with a little bit more of a fragile vein. Some of our pediatric patients. 24 gauge, which is even smaller, that is definitely for pediatric patients. Some of our really fragile skin veined patients might get those too. 18 gauges, those are for surgery, for trauma. They can also be for your typical patient depending on what they're getting. 16 to 14 gauges are usually for trauma. So we're gonna go ahead and open our needle. Now there's a couple parts to this. I'm gonna go ahead, I'm just gonna show you the parts. Once I take this off. Okay, so this is an angiocath. Right here, you'll see where there's like a little notch right there. That you're going to twist all the way around just to help loosen the plastic from the needle. Then there's this little white button here, and that's what you're gonna use to retract your needle. And then on the needle, there's something that's kind of slanted down. That's called the bevel. You want the bevel to be pointed up, which means the slant points up. So, I'm gonna go ahead, I am going to recap this. Remember, we always recap with a scoop because you don't wanna poke yourself. Okay, I've got it loose, I've got it ready. So we're just gonna set it off to the side for a second. Of course, we wanna cleanse with alcohol. And some people like to use gauze to kind of help clean up after themselves. The one thing I did forget to mention, right here where the spring loader is, right below that, this is where you're gonna look for that flashback. So when you stick the person, blood will start to fill that, and that's when you know you hit a vein. Our mannequin doesn't have any fake blood, so you guys will not be able to see that. So let's go ahead, we're gonna put our tourniquet back on. It varies on how long you can leave a tourniquet on. Most places say less than a minute. So then I'm gonna clean. You definitely wanna make sure you clean that area really well. I kind of like to go up and down and then a circle. And then once I'm done with that, I do my circle on out. I like to leave my alcohol with one of the corners pointing towards the vein. It just helps me with visualization. You're gonna wait for that to completely air dry. And that's when you're gonna go ahead and take your needle, make sure that bevel's up. So again, remember the point is gonna go straight into the patient. You're gonna pull their skin down. So I would pull and displace some of the skin and help stabilize that vein. I'm gonna go in at an angle. Now these mannequins are very strong. So you're gonna go in until you see that blood return. So I would see blood here. And then you wanna push the catheter back in. Now as I slowly retract my needle, I would start to see blood fill up this blue as well. So here I'm going to go ahead and occlude. So that means push down on that vein, keep that vein from bleeding a lot. There, I push that white button. Then I would grab my J-loop. I'm pulling off that plastic part and I would connect. Okay, once I do that, you wanna pop your tourniquet. It's really important because if you were to flush with that tourniquet on, you'll pop the vein, which is then going to make the IV not work. So what I like to do here, I like to flush a little bit. You might have to retract a little bit so you can see that blood, and I flush just a bit. And once I feel like I'm in a good spot, you want to put this dressing where it inserts into the patient has to be within this window. And I like to put it like this. So if you can see, right where that little opening is, I put right on the blue. That way, if there's any loosening from the catheter to the actual J-loop, you can tighten it up easier. Now we're going to open up our dressing, take off this paper. And I know some dressings are heat activated, so you can use the heat from your skin and the heat from the patient's to rub that, and it makes it stick a little better. Then you would take something and you can put, some people put one of these under, some people put it over. I like to put mine over, but don't put it so tight that you're pushing this catheter down into their skin. Then I would write my name and date that I inserted it here. But now that I've done all this dressing and manipulating, I wanna go ahead and flush again, just because I wanna make sure that all that movement didn't displace the IV. So then I would just flush it again. And then we'd be done with inserting the IV. But now we're gonna pretend we've assessed our patient and the IV is still really good, but the dressing, maybe it has some blood underneath. So I wanna show you guys how to actually change the dressing without disconnecting anything else. So when you do that, you have to be very cautious because we don't wanna pull out an IV unnecessarily. So I'm gonna start taking off the dressing. Might be a little tricky. And when you take this off, you take it off away from the catheter. So the catheter, you take it off with the catheter. Let me rephrase that. Because if I were to take it this way, I could pull the catheter out. So I'm gonna take it off. Remember, the catheter is going in here, so I'm gonna take it that direction. And I'm using my other hand to stabilize. Then I've got this dressing. I would pull it off, and we're gonna place it just like we did that last one. And again, we always want to label. You would write your name, date, and time here, or at least your initials, depending on what the policy is. And then every time that you mess with any IV, you definitely want to flush it because we want to make sure that it's still a good working IV. All right, and that's it.